Ladies and gentlemen, dear colleagues, thanks for the invitation to this very interesting Congress. My duty is to talk you about how to prescribe physical activity. In the last 20 years, it has appeared very clear that physical activity modifies the body in a shape that it is able to reduce death for all causes, death and also disability. Being physically active reduces the risk of cardiovascular diseases of 30%, type 2 diabetes of 40%, colon cancer of 30%, depression of 30%. Being active can give us 3 to 7 years more of life. But it's not only more ages, it is quality of life. We have wonderful examples of athletes of 93 years old able to perform a marathon. So it means that a 93-aged person has the same physical capabilities of a person of 50 years old trained. This means that physical activity can change biological age, which is so different from anagraphic age. Exercise is medicine and must be tailored as a prescription. We know everything about our biological parameters. We know how high is our arterial pressure. We know about our blood sugar. But how many of us know their physical capacity? This parameter is very important to determine the capacity of survival of our patients. So, how many doctors are able to investigate the physical capacity of their patients? We know that physical capacity is the most important and independent determinant of our cardiac risk. We can have whatever pathology, but if we are trained, we live more. American says, it is better to be fat fit than slim and fit. So it means that physical ability to perform a workload is a factor much more a determinant of our biological and biochemical health. Now, investigating physical capacity can be very challenging, but also very easy. For example, if we ask a subject how many meters he is able to perform in 6 minutes, we have an information which is determinant to understand his physical ability. If he performs 600 meters without problems, he probably has a good cardiac health. If he is not able to perform more than 300 meters in 6 minutes, we think that there is a cardiac problem or a metabolic problem. Anyway, a complex problem, so he must be referred for an examination. This parameter, meters performed in 6 minutes, is strictly linked to maximal oxygen consumption, which is the maximal capacity of the body to use oxygen for metabolic processes. Oxygen consumption is measured in liters per minute and reflect the ability of the body to inhale gas, to transport it through the blood, thanks to the cardiac pump, to all organs and muscles. The higher the oxygen consumption, the higher is the aerobic fitness, or the capacity to work in aerobic conditions. A high oxygen consumption gives protection against all causes of death. And similar protective effect is given by muscle fitness. These are the reasons why the World Health Organization suggests us to perform a certain amount of physical activity to reach the adequate level of physical fitness. So for adults, it is suggested to perform from 150 to 300 minutes of moderate aerobic exercise every week. Older adults should also perform 2 times a week muscle exercise for big muscle groups. It is important to note that the exercise prescription should follow the FIT recommendation: frequency, intensity, type and time of exercise. So we can have a tailored prescription. Being said this, it is important to note that starting suddenly a high-intensity training could be dangerous for a sedentary subject. So a screening is mandatory. For low levels of physical activity, most people can start a program, even with a PARQ questionnaire, which investigates the main risks for cardiac, orthopedic, neurological troubles. For higher level of risks, it is suggested to perform a medical screening. Thanks.